also an issue and something that I think Congress can continue to work on in terms of lowering those costs.
Great, thank you, and I yield back.
I thank the gentlelady. Call upon Dr. Ferguson to inquire.
Thank you, Mr. Chairman, and thank you to each of the witnesses. Ms. Wood, especially thank you to you. I was a practicing dentist for 25 years. Part of your story touched me, and certainly recognize that. Have dealt with that many times in my practice in many different forms. So very sympathetic to your position there. But one of the things that is just very striking in all of this to me, and my colleague from Ohio touched on this, as I listened to all of this, there are very few people in this room that have actually laid a hand on a patient and been down in the trenches every single day trying to find ways to make patients healthier, get them more convinced of preventive care, and drive down cost. The way we do that every single day, the way we did it in our practice. And it's a real challenge when I hear people talk about a healthcare system in which they have never once been a part of, other than maybe as being a patient. We can all talk about the sympathetic situations and the very tragic situations in many cases of our family members, our friends that have gone through these terrible illnesses. And I think that we all recognize and we all want those with pre-existing conditions and those that are the least among us and those that have the most catastrophic illnesses, that we can, as a nation, take care of those folks. But to destroy the entire healthcare system is not the way to do that. Let me tell you something. If you look at this plan, the doctor-patient relationship, which has already been eroded, would be completely done away with. You would have unelected bureaucrats telling doctors what you can and can't do with a patient. Matter of fact, the federal government would dictate the practice of medicine as the Democrats' leading single-payer bill in the House requires the Secretary of HHS to establish a single national practice guideline for all patients and clinicians to follow. That is tone deaf and it is irresponsible. All patients are different, providers are different, and we need the flexibility to adapt health care to each and every single patient. To think about treating hospitals all the same and having to, as my colleague from Illinois stated, basically ask permission from a bureaucrat to change a light bulb in a hospital, that makes absolutely no sense. What's right in rural Georgia is probably different than what's right in Chicago. Both have needs, but this one-size-fits-all policy will not work. I can tell you there's nothing more frustrating to a patient than having their choice removed. I can't tell you the number of times that I sat with a patient in my practice and had to tell them that there was a bureaucrat either in an insurance company or in a federal government office that was denying them care and coverage of care. Somebody without a health care license, a medical or a dental license, was telling me how to practice medicine and telling a patient what they could and could not receive. Last time I checked, I was the one in the room with the patient, along with my staff, talking to the patient about their unique circumstances to be able to make the right decision for that patient. That patient had choices. The patient was able to express their concerns. We were able to talk through it, what their fears were, what their needs were, what the potential outcomes could be. And what this will do is it will destroy that doctor-patient relationship, and it will destroy the patient's choice and freedom. To think that a single-payer system is best for the patient is laughable, in my opinion, okay? Can we take care of our most vulnerable? Absolutely we can, and we have a desire to. Can we to make sure that we keep the promise of Medicare to our seniors that have been made? Absolutely. But we should be creating competition. We should be creating vitality within our healthcare systems. We should be doing everything that we can to drive the relationship back to the patient and the doctor and away from the bureaucrat, because it is destroying healthcare in this country every single day. And those that have never had the privilege of laying a hand on a patient to take care of them simply don't understand this. We understand it as patients when we can't have those choices and we can't get that care. But if you haven't been a provider on that, you don't know the passion and the desire to take care of a patient, you're just completely missing the boat, and you're making this about a dollar sign and not a patient, and that is wrong. And with that, Mr. Chairman, I will yield back.